Migraine headaches, TMJ, and sleep apnea are all types of orofacial pain that can be treated by a specialized dentist. And joining me now is Dr. Stan Farrell, who is a board-certified orofacial pain specialist. That's a mouthful, but people really need to come see you.
Oh, yeah.
What are some of the first signs? I mean, you talked about how migraine headaches. If you're the type of person who's taking a lot of medication, they should really come see you, especially for that.
Yeah. If you're having a hard time with your migraines, keeping them under control, you've seen a neurologist, and you're taking a lot of medications and things still aren't working well, it's good to keep in mind that a large percentage of these migraines are being triggered by head and neck pain. And it may not be a lot of pain, just even low levels of pain, such as from your jaws, your neck, or anything like that, can trigger the migraines. And that's really how it works. So
we have a graphic you want to look at? So let's look at the graphic that we have to kind of give you an idea of what's triggering it.
So you can see here, here's the brain, and there's an area called the trigeminal nucleus caudalis, which is kind of the relay center. And basically, if you have pain feeding into that area, it triggers, and you see the little line over to the blood vessel there, and that's representing the migraine pathway right there. So this is the area where migraines are triggered. So not only smells and tastes and other things that can trigger migraines, but a lot of it is pain signals. Okay, so basically that's what we do is we go ahead and we take a close look at that. We do an analysis of all the muscles and the joints and the head and the neck and the nerves, and say, okay, is there anything here that can be triggering these migraines?
I see. So you really take a picture of the brain. You really need to look at a scan of it. You can't just...
Yeah, we do that too. We do that too. Yeah, we use MRIs and things of that nature as well. But really zero in on the problem. Do you have a joint problem here? A lot of people do. Popping, clicking, things of that nature.
Right in here?
Yeah, in the jaw joint, the TMJ, as it's called, and these can progress. Okay, so it's important to pay attention to these things. So if you notice you got a lot of popping and clicking and occasional pain when you eat certain things, say you eat a bagel and it hurts, right? And you've got this tremendous migraine problem as well. Well, odds are they're connected.
And your regular dentist would not be able to do this for you, right? There's a difference.
Yeah,
obviously.
exactly. Okay. And the thing is, it turns out, after spending years studying this, that it's actually more medical than dental. Okay, so it's more joints and muscles and nerves as opposed to how your teeth fit together.
I see.
And that's important to keep in mind if you want to get a good diagnosis and get some good results.
And how can you treat it then if you find that it truly is being triggered by these joints?
Well, if it is a joint problem or a muscle problem, you're going to treat it appropriately. If you want to take pressure off the joints, so we have orthotic appliances that we make that kind of reposition the jaw. We also will treat the muscles, okay, and have people, go on a soft diet or make, therapeutic changes, as well as a little physical therapy as well. Yeah.
And you treat sleep apnea too? Is that with those same devices you just mentioned?
Yeah, you know what? Yeah, the sleep apnea devices are a little bit different, kind of the same idea. In that case, what we're trying to do is just open up the airway, okay? As opposed to like a CPAP machine is a machine that people with sleep apnea use, and it forces the air down.
I see.
The appliance therapy is different in that we're pulling the jaw forward and mechanically opening the airway so the air can get through as opposed to forcing it through.
Very important. And what is your goal for your patients when they come to see you? I'm sure you have people come to see you in pretty bad shape, especially if they're sufferers of migraines.
Yeah, absolutely. Well, our goal is to really diagnose the problem and get them treated, get them on the right path, and also give them realistic expectations of what kind of results they can get.
Very important. So if you're out there and you've been suffering with some of the things we mentioned, sleep apnea, migraine headaches, you really need to see somebody like Dr. Farrell who specializes in that kind of pain. So if you want more information on the treatments that Dr. Farrell discussed, of course, you can visit azheadache.com or go to aztmj.com, and there is the phone number right there on your screen.